Hey everyone, welcome back to the channel. Today I'm going to be doing something a little bit differently, and I'm going to talk about kind of what this channel really is supposed to be. And I've kind of pushed this off a little bit, but I think now's probably a good time to talk about it with everything going on. So one of the things that I wanted to talk about in this video is really kind of this progressive conservatism and what does that mean in the political realm, and really kind of like what does that actually look like in a policy implementation standpoint. So I'm just going to kind of give like some brief like kind of ideas of like what that can be, what that can look like. That way, for those who are interested in this kind of ideology can kind of see, okay, this might be how you can have this progressive policy vision and then build in some conservative and some American value based systems within that. That way you can maintain kind of what you're wanting to have from a conservative standpoint, but ultimately reaching out and hitting your progressive goals. So if you like what we're doing on the channel, please like and subscribe, comment down below the next video that you think I should do. I'm thinking about kind of doing more topic-based, such as healthcare, maybe defense, foreign policy, and the like. I'll admit a lot of these ideas that I have are typically going to be kind of this middle of the road establishment, while at the same time being progressive and implementing conservative values and American values within that new system, and also having a populist mindset, right? So making sure that the uh, policies and the end goals that we create ultimately work and benefit everybody. I'm going to start off with what that looks like. So one of the big ones that I've kind of been grappling with is when you look at the Democratic and really kind of the Democratic space, is you've got this, do we have a public option or do we have a single payer system? So one of the things that a progressive conservative would be looking at is they would say, okay, well, we need to work towards a system where we actually have universal healthcare. I think right now we're around 92% of everyone is insured, but you still have that 8% that isn't insured. So one of the things that we want to do is we do want to move to a universal healthcare system, one that basically, includes a public option while at the same time ensuring that all of the core uh, services that are provided within that health system, such as simply the ones that don't really make a lot of money, but are extremely important. So your preventative services, your primary care, your mental health, maternity, newborn, pediatric care is another big one. Vaccines, chronic disease management, and then kind of your emergency room, emergency trauma services. So really, kind of the reason why we focus a lot on those is because they are high value. You think about, everyone likes to talk about the fertility crisis. Having more care in maternity and newborn can give you maybe higher fertility rates, or can reduce, uh, uh, you know, uh, people losing their lives during pregnancy, as well as making sure that the health of that child is going to be as great as it can be. A lot of this is like those prenatal care that would be included in this as well, and making sure that kind of people start off right, right. So that's kind of this big progressive viewpoint where a lot of people would maybe kind of get behind, like, yeah, we need to cover those things. And so, hey, we're going to have this system, but how do you really kind of build in those conservative values? So a lot of those would be that public option, right? So you can opt out, you can still have the private insurance, but also making sure that, hey, we're going to have a standard coverage that everyone's going to have. Now, you still have private insurance because something like dental care, maybe vision care, or maybe some long-term inpatient care, um, or if you're going to really have really brand new devices that come out, those might be kind of covered by more primary or secondary insurance, whereas that public option, universal care option, essentially would cover a lot of the basics, right? So, an example, I work at BD, so hey, we're going to give kind of a Foley catheter to somebody, and we're gonna, that's gonna be their urine management system, right? Whereas, maybe in this new system, one of the things we want to do is we still want to foster, competition between, the medical device companies and everything like that to drive new standards of care. So maybe they would, you'd come out with your PureWick, your external catheter, that a lot of people like. It's so great, all this other kind of good stuff. You still have that option for that other Foley catheter, but PureWick is going to be the new thing. So you want to make sure that you're not having your system, essentially a governmental system, dictating kind of where that innovation goes. You still kind of want to leave that out there for medical device companies and pharmaceutical companies to really kind of target, hey, here's where those needs are, and then providing that minimum floor for those services such as mental health, therapy services, and another one. Then you can shift people to these other care options so that people are getting, the mental health that they need. They're getting their chronic disease management met, because maybe typically now a lot of those patients are maybe on Medicaid because of those long-term chronic disease management systems that they're in, is a huge drain on the system, very expensive. So having the government come in and kind of manage what that cost looks like can go a long way for people. Whereas doing that and then also allowing that innovation, that R&D to happen so that those costs over the long period of time can go down. Whereas if you have a single payer system, you have a lot more sway of, okay, here's what we're going to pay for and here's what we're not going to pay for. Whereas you want to still kind of allow the private insurance to come in because they may cover other options, or they may cover the higher technology that maybe the public option doesn't get there yet, because they want to provide basically basic services for everybody in the group. A lot of kind of European countries work this way, where they do have, say, a single payer, or they do have a public option, but it's kind of in this network of public private payer. So another kind of example would be, we can then look at, okay, well, how are we going to administer that system, right? So one way is that the conservative kind of the American value is hey, we want to have this federalistic government, right? So and you see kind of some conservatives talking about this now, where instead of having Medicaid being open-ended or something like that, giving block grants to the states and then allowing them to manage their health care and their needs and everything like that. So obviously, people who are in Tennessee maybe have different healthcare needs than someone who might be out in Montana, right? And so having different healthcare systems with run by these states kind of allows the competition, allows that new development of ideas. Whereas if you just had one singular omnipresent view run in the federal government, then it may not kind of get the exact answer that you want. You may not get those long-term innovative solutions. You might not get a uh, lower care options or lower cost options, and really kind of managing those costs, right? So that's one of the examples that people like to cite a lot for, what capitalism and those kind of things could do, is that over the long term, especially if you do have you don't have a super concentrated power, is that you can then you're supposed to have lower costs because people are supposed to compete and bring down their costs as low as possible so that they can compete with one another, right? So one other part of this is that, yeah, you've got these 50 states, but then maybe within these states, maybe we have requirements of, hey, here's how many insurance companies that are going to run this minimum care option. We're going to have, say, maybe 10 of them or 7 of them, a minimum. And then you don't have, say, 2 or 3 that are basically just running these exchanges in the states. You kind of spread that out, provide a lot of options, and allow people to kind of pick and choose where they want to go. So they kind of be given a voucher, right? So that's another kind of conservative principle, where you're given this healthcare voucher, and then you're going to go and you're going to spend it wherever you want to spend it. So there's ways to kind of build this into a system like that. One example, instead of a public option, is a Patriot option, right? So we want to build in, this kind of American, this nationalist, this progressive, this kind of middle of the road establishment populist idea. So maybe using something called the Patriot option, as a kind of a new nomenclature. So now, one way that this would do is with this new public option, we would rearrange how the subsidies work. Obviously, the idea is to kind of bring down some costs, so maybe you don't need as much Medicaid costs, so you can kind of hit that financially, that fiscally responsible perspective that conservatives really are pushing for. But as we all know nowadays, no one really kind of does that, right? So another example that a lot of people are really pushing for is, say, healthcare savings accounts, especially for younger people like myself. You aren't going to be spending a lot of money, so maybe you can give people the expand kind of what is covered in this. You can expand. You know, Maybe there's matching from your employer, or maybe there's matching from the government. They can kind of do a lot of different things with these healthcare savings accounts by giving you the choice of, hey, what you're going to cover, what you're not going to cover um, with that HSA. So one thing that me and my wife do is we don't cover everything, and then we actually keep a lot of that cost that we would put into our HSA since it's tax free. Then you're going to put it into, say, maybe you're going to put into the S&P 500 index fund, let it grow, and then maybe in 20 years when we need to start drawing from that, well, now we've got 20 years of putting in, say, $30,000 into this healthcare savings account. So now we've got a lot more money pulled up that we can kind of pull from, right? So expanding kind of what those HSAs are, allowing people to choose, allowing people the opportunity to, put their money where they want to, giving them the choice of what they're going to pay for, and things like that. Additionally, price and quality transparency. So, conservatives really talked a lot about this in some alternatives to um, the ACA and some other ones. Josh, who's on the channel, he's a big one on this, of giving competition, removing con laws, removing a lot of these local inhibitors, especially in state inhibitors of where a hospital can be, how many hospitals can be in an area. We want to expand choice. We want to provide as many hospitals possible. And then once you start getting out into these rural communities, you don't want to have any limitations, especially with underserved communities, of where you can put hospitals and put care. So those are some other kind of price transparencies. Putting up, hospitals got to list how much things are going to cost, not just hospitals, but maybe your physician, right? So one example is I actually went to the urgent care. So we had our floors redone here at the house. Stepped on a nail. Need to go get a tetanus shot. Went to go get a tetanus shot the next day. Just the urgent care right around the corner from my for my work, ended up paying $253. So if I had the opportunity, like, hey, I need to get a tetanus shot. Okay, well, I can go to Piedmont and pay $250, or I can go over here to Northside, urgent care, or I can go to the CVS. If I can pay different amounts, I'm going to go and do that, right? I know what I need. I know, really the quality of that care, which, to be honest, the quality of care that I got was pretty shitty, right? So I'm like, hey, I'm not going to go back there and get another vaccine or another tetanus shot. I'm going to go somewhere else. And so having these opportunities can really make people have the ability of kind of going where they need to go. Obviously, for emergency care, that's not really something that's going to be able to be done. But for your primary care, for your maybe some surgical procedures, maybe you are interested in that. Pharmaceuticals would be another one. Hey, one thing that Cost Plus Drugs does really good at, I buy prescriptions from them, is they're lower cost than what I'm actually getting at my CVS, which is the preferred pharmacy with my insurance. So I'm paying cheaper out of cost or out of pocket than I would be going through my insurance. So, letting people see, okay, hey, here's what the cost is going to be. Because once people are locked in, you're going to go to wherever you're going to go. But hey, if you get the opportunity at the very beginning, like, hey, you can go here or you can go over here, then you're going to make the smarter decision for yourself. So price and quality transparency is huge. That's going to be something that we need to do at the federal and the state level, but that's going to be in that progressive conservative healthcare system, right? The progressives kind of know what they want to hit, and then the conservatives are sitting here building out ways to kind of lower those costs and then improve choice for people. Portability and worker-friendly coverage. So that's another one. We see it in that public option where you're not tied to your employer. So maybe working and trying to not have that, and it's a big one for me, is not having your insurance tied to your employer, right? Like, you should be able to buy high quality insurance at what you'd be paying with through your employer, or at a similar rate, or maybe you're going to pay a little bit more of a premium because you want to have that transferability. So you think about people who are contract workers, right? So they're not getting their health care through their employer for the most part. They may want a public option to where, hey, I'm going to work for so and so, but then I'm going to go over here and do this. And I think one thing we can do, especially with this with this conservative and progressive healthcare system, is that if you want people to have choice, right? So I don't need if I can get a public option that's competitive or comparable to what I'm getting now, maybe I want to go and work for another company. So if I can do something like that, where maybe I'm thinking about going to another company and I don't want to lose my health insurance and have to wait and kind of do all that kind of stuff, maybe I'll go and work and get a public option to where maybe I'll pay a little bit of a premium for having that portability. But I'm not worried about losing coverage, especially if I got kids or if I got, my wife is thinking about having another kid. Maybe that's something that I don't want to worry about. Payment reform, obviously a big one that you hear, especially from Democrats and conservatives now, value based care. How are you how are you able to drive value in the care that you give? Now, I will say this is really, really, really hard. So, what kind of how this ends up working is you really need to tie it into the next thing, and that's going to be your public option, and then kind of the social determinants of health. So, working together as a healthcare team with your physician and your clinician, and then working with your public health, and then working with your dietitian and your nutritionist. Everyone needs to be working together and needs to be on a patient, even if they're five, let's say 15% body fat, and they're not worried about diabetes or they're not worried about some of these other issues. You know, we need to be on the same team, and we need to change how we implement healthcare. Because if we do that, then you can go into a value-based healthcare and say, okay, hey, we can get the patient to take their prescriptions, or we can get the patient to do a lot of these different things. And if we can do that, then we can actually say, hey, going and working or going to Piedmont, is a better way than Northside Hospital, because Piedmont really values that whole holistic, implementation of healthcare. Whereas a lot of people just want to say, oh, well, it's what you're paying your doctor. Well, your doctor is going to do that fee for service and he's going to do the surgery. But if you're not going to, if you're walking up and running like my brother did when he got his knee surgery done, yeah, you're going to have stitches blow open. You're going to have maybe a potential infection. Is that on the doctor? That kind of goes into um, that conservative view that, hey, we also need to have some individual responsibility here. So as we're going to have these teams care for people, it also is going to be dependent on, hey, you've also have to have some sort of individual responsibility. Now, I believe as a progressive, we got to give as much resources to patients. We need to have people that are going to come in there and help them and, check in on them when they're at home and make sure that they're getting the care that they need, making sure there's not any issues that are just going to linger or fester that end up becoming bigger down the road, or making sure that they're actually changing their drapes. So you can kind of build this into a lot of that care economy that you hear people talk about. That's another progressive kind of idea. So we need to really look at how we build these teams out in healthcare so that we can really do give the best quality and value. And then you can go in and then start actually charging hospitals and paying hospitals, or I shouldn't say charging, but you can pay hospitals for the services that they provide. Um, Malpractice, regulatory reform. Obviously, we got regulatory reform that we need to do on everything. That's not kind of a big one that I'm going to talk about here. But that goes into your licensing and your what you can do to practice. And then also looking at malpractice reform. You hear tort reform and all that kind of good stuff. So that's also another one out there that people talk about. So I'm not in the legalese of that, but that's something that we also need to make sure is working for patients, working for and that it's fair, right? So rural, veteran, and safety net strengthening. So one thing that we need to do is we need to make sure that underserved communities, not just those out in the rural Tennessee, right? Where your community health centers, your um, your small family doctors, ones where you're maybe 30 minutes, where my wife lives, she's probably about 45 minutes to an hour drive away from the nearest trauma unit. So she's out, if her dad's out there baling hay and he gets wrapped up in a combine like we've seen before, not with him specifically, but with a lot of rural communities, the life expectancy of them is not very high. And we want to change that. So we want to make sure that we're bringing point of care diagnostics and we're subsidizing that into communities so that, hey, we can't get you to a healthcare or a hospital for whatever reason, maybe you're out in Montana or you're out in Idaho and it's just so far away to get to them, we can bring in telehealth, we can bring in innovative diagnostics and tracking systems and monitoring systems and manage you from home, where we've been able to show there's much greater quality of care that people get. So that's also another way that we want to really kind of build into that progressive, that higher quality, that better quality care that people are going to get. We want to make sure that that's something that we can do. Um, Rural healthcare, I mentioned that. Veteran healthcare, another one that I've been looking at is, um, we want to make sure, VA hospitals are taking care of their patients that they're supposed to. We shouldn't be allowing people to, linger and not give our veterans the better healthcare. So I think opening that up to potentially, outside, bringing in competition with that. We saw Trump did something like that where, now you can go in and you can go to your own healthcare person instead of going to the VA to get service. So that's something that we're looking at, and would definitely be something great. Obviously, we need to look at, with the funding and the fiscal design. Obviously, so I'm someone who's not a conservative, who's not scared of taxes. You're going to show me, hey, here's what your taxes are going to go to, and here's the system that we've designed to accompany that, and here's how we're going to roll it out. Here's who's going to be covered, and really laying it out there and walking people through it. I don't mind that. If you have accountability in your system, I don't mind paying taxes. Now, obviously, I don't want to pay 10 extra percent of my income to do that, but you think about, hey, an extra 2-3%, and then you don't have to, have your uh, and this would be if you did the public option. If you don't have or the Patriot option, as I should say, and then you don't have to put money in towards insurance, maybe you get similar care, similar benefits there. That's something that we can look at as well, and that's something that we should be doing. Implementation, this a lot of this stuff would just kind of be like you have to, especially with healthcare, right? I think healthcare spending is trillions of dollars, right? It might be up to 4 or 5 trillion. It could be lower than that. I haven't looked at the most recent numbers, but one thing we need to do is we need to look at, hey, you're going to implement something here, so maybe we need to, hey, we're going to do a very lean public option, and then we're going to slowly put in some of these reforms that we just talked about as we're going through, right? Let's give everybody the public option, and then let's start worrying about veteran health care, and then we start looking at the value-based healthcare decisions that we just talked about. Building that in and going in a stepwise manner, I think really brings in accountability. When we look at, say, with the ACA subsidies we have, what we're dealing with now. Being able to think that, okay, like, decisions that were made in January about Medicaid, Medicare, and the ACA, 6 months later, that's not enough time to maneuver, right? So I think we really do need to have a stepwise solution. A lot of progressives don't really like that, but I think as a conservative, hey, like we need to slow this down. We need to make sure that things are implemented the right way, and that we don't have an Obamacare marketplace issue like we did in with the ACA. So definitely something that we can do. Like if you're constantly hearing, hey, like that's a progressive idea, but then building in those conservative values, building in those American values of free market, of free enterprise, or free regulated free market in there, and being able to really kind of put that stuff together is how you're going to get across. You hear a lot of these DSA people, oh, we just need a single payer health system. Maybe we don't. What's going to be covered in that? You don't ever kind of see a lot of that depth go in there. A lot of people do, and a lot of research articles you'll see. But what's covered, what's not covered. You go and look at, say, the conservative viewpoint where they say, hey, it's going to fix itself. Maybe we need to put more competition and just do price transparency. It's got to be somewhere in between, and that's where progressive conservatives live. Um, Last thing I want to talk about is looking at kind of um, some risks of progressive conservatives. I'll be honest, it isn't going to be flawless. I'm not one of those theorists or ideologues or practitioners who think that, okay, we're just going to do this and it's going to happen. We talked about the phasing. We talked about we got to get buy-in. We talked about how we need to make sure that those HSA accounts that we talked about are being shifted in a way that, hey, not just upper middle class and upper class people are benefiting from them. But hey, everyone from the low class, middle class, working class, all the way up benefits from that. We also need to talk about, price controls, or not price controls, but how do we control prices? Free market's great, but maybe, price transparency, value-based payments that we talked about before, and some of those ROIs of what we're actually going to pay for. We need to have constant review of those. We need to make sure that, you know, the where the federal government is using its power in a way that's not just responsible, but that is fair. That's also a key part. We don't want a healthcare system where, say, what you have in China, where they just say, hey, per state or whatever it may be, basically they're going to select one supplier and then they're going to do value or volume based pricing. We don't want that, right? We don't want where, hey, they go in there and say, okay, what's the lowest price you can get of all these people? You're going to be the one, you're going to supply the whole state. We want to allow innovation. We want to allow those kind of things there. But at the same time, if you're not controlling enough for the pricing, you kind of go into where we are now, where you've got a very high quality care for those who can afford it, and then you don't have enough care for those who can't afford it. So when we think about healthcare and we think about how progressive conservatism is going to work and how it's going to be built into these systems, we need to think about the whole picture. We need to think about timelines, risks, scheduling, HSAs, all the way to who's getting what, who's funding, and making sure that there's still enough innovation that's being done, and that in the long term, we're delivering better healthcare at hopefully a cheaper cost, if not what should be cheaper, or you're failing. But making sure that everything is being done in the way that we expect it, and making sure that we're agile enough, especially in our policymakers, which we can get into this in another part, with, they have the HELP committee. So health, education, labor, and pension. Healthcare, it's a 3, 4, $5 trillion expense in the federal government. That should probably be its own thing. You should have your own senators and representatives sitting on a committee where all they do is worry about healthcare. So it's going to be a complete top to bottom restructuring that we need to do. A lot of these systems that we have are just in place, like HSAs and everything. It's just tweaking. But at the same time, you've got a public option and you've got universal care and, kind of the basket of goods, you'll hear a lot of people call it. A lot of that stuff is going to be new, and we need to make sure that we articulate it, and we need to make sure that we are presenting it in a way that we can get buy-in from both sides of the political spectrum. We can bring in conservatives, make them feel good that we are holding government accountable, while at the same time bringing in progressives and really kind of all of society understanding that we're hitting those progressive views, those progressive policies that are going to be better for people. That way we can have higher productivity, people aren't going bankrupt, and the healthcare economy is still growing and doing what it needs to do. So that's kind of my pitch. That's kind of my quick, I don't know how long we've been going, but maybe 20 minutes or so on healthcare. So if you like what we're doing, like I said, like and subscribe, post down below, and I want to hear what you think. Where did I go wrong? What are some things I didn't think about? I just did a quick video, but let me know. I'm definitely here to learn. This is a conversation, and I'm curious to see what happens in the next part. So like and subscribe, comment down below, and I'll see you in the next one. Thanks.